Hi there, my name is Elizabeth Muir and I am a MSK, Musculoskeletal and Pelvic Health Physiotherapist. I am also a clinical Pilates practitioner with over 14 years of experience. Over my 14 years, I have supported and guided over 40,000 clients. These clients come to me for my professional and passionate care. I treat a variety of clients, and within my pelvic health clinic, I have male and female clients coming to me for support with incontinence, pelvic health, prolapse issues, and pelvic floor support. So working those pelvic floor muscles. We all need to work those muscles, and I think the gentlemen out there sometimes feel that that's not something that they need to work on, but it's vital for all of us. With regards to my physiotherapy clinic, I treat a variety of clients, those that might be from a sporting background, but also those that are recovering from surgery or illness or post-birth. My Pilates that I teach is a type of modified Pilates. What this means is that we can open up the exercises and adapt and suit them for everybody's needs. I strive to provide a bespoke treatment for every client that I see. I take time to listen to their concern, work on our expectations, and look at a suitable exercise routine that is going to help support them get over the issue and those niggles that they might be having, but also suit their everyday life. With physiotherapy, I want it to be part of your day, not an issue, not a thing that you have to go away and find time to implement it. So that time is taken so that we can work out the best routine for yourself. If you're feeling that you've got a niggle that you want to get addressed, if you've had some pelvic floor issues going on for a long time that you want to seek some help, please do feel that you can get in touch to book a session with myself. I really do hope to hear from you soon.